Paranasal sinuses. This is a skull bone. So, in the skull bone, inside you have empty spaces. These empty spaces are called sinuses. So, everybody, we all have 4 sets of sinuses. As you see in this picture. So, this is the first set, which is a frontal sinus. This is the second pair, which is a maxillary sinus, and the third pair, which you see here, that is near the eyes. I am supposed to draw one more here. I have drawn only one. So, you have one more here. So, the third one is the ethmoid sinus or ethmoid air cells. And the last pair, which is seen way behind the nose, is called as the sphenoid sinus. So, all these sinuses are seen in the corresponding bones. They are named after that. So, totally you have 4 sets of sinuses. Now, during birth, normally a child will have ethmoid and maxillary sinus, and by the age of 6 to 7, frontal and sphenoid sinus starts developing, and by 18 years of age, you have all the sinuses present in that particular person. So, if you ask me which sinus is normally involved in a child, the answer will be ethmoid, and along with that you have maxillary sinus infection also. But after the age of 18, any sinus may be involved. Now, as I have already mentioned, these paranasal sinuses are air-filled spaces. So, now let us see what are the normal functions of these sinuses. The first function being it warms up the inspired air. So, whatever be the outside air temperature, so when you breathe in, the function of the nose and the paranasal sinus is that it warms up the inspired air and changes it to the body temperature and lets inside. That is one of the most important functions. The second important function is, there are so many functions, I just picked up a few for common information. Now, the second information is the voice resonance. Voice production is in the voice box, as you all know. So, here this whole unit starting from the nose up to the vocal cord is a single unit. So, after voice production, there are certain words or consonants which requires a normal functioning of the nose and the sinus for its normal pronunciation. The words are M and N. If the sinus or the nose is blocked, these two words cannot be pronounced normally. So that means for these words pronunciation normally, you need normal function of the nose and sinuses. Now, the third function being temperature buffer. It means that you have so many important structures in the face. So, any sudden change in temperature, it may affect the concerned organ. So, you have empty spaces in between, so that these sudden temperature changes doesn't affect those organs. So, this is what meant by temperature buffer. Now, another important function of sinus is that the skull bone as such, for weight reduction of the skull bones, you have empty spaces. And this sinus, it acts as a shock absorber. When you have a trauma, the whole trauma, the shock of the trauma, it is not directly transmitted into the important structures. It gives protection for the important structures. The shock is completely absorbed because you have air-filled spaces. Now, all the sinuses, I have mentioned that these are air-filled spaces, but even though I have mentioned air-filled spaces, it has got a lining, and in that lining you have mucus glands which produces mucin. This mucin is water-like, means it is sticky, and it is continuously produced every day. And this mucus, which is produced in the concerned sinuses, it flows to the normal ostium. I will show you the pictures also. It is directed towards the nose, and it goes back to the throat and into the stomach. That's how it is normally, that's how it works normally. I'll show you the pictures also. So, mucus production is one of the important function, and this mucus has got so many important contents which contributes for protection of the upper airway. So, it has got lysozymes, it has got so many different enzymes, immunoglobulins too. So, it protects us against bacteria, virus, fungal invasion, so many things. So, in short, it forms a part of immune system also. It protects the upper airway. Now, the last being, for the normal growth of the facial bones, you need normal development of the sinuses also. Now, I have mentioned you about the normal mucus production and the normal movement. See, if you see this maxillary sinus, in the maxillary sinus, in the maxillary sinus, you have so many hair in the mucus lining, you have so many hair-like structures. These hair-like structures, it beats towards the normal opening of the maxillary sinus, and it transports all the mucus production produced to this sinus, which goes into the nasal cavity. So, in this maxillary sinus, in all the maxillary sinus, this is the direction of the movement of the cilia, so that the mucus is conveyed into the nasal cavity. But in frontal sinus, if you see, it goes anti-gravity, it goes up, then goes sideways, then it comes down towards the natural opening. Here when it reaches, majority, say about 70 to 80% goes down into the nose, and 20% there will be recycling. That is for the frontal sinus. Now, for the ethmoid sinus, the movement is spiral in effect, and with the spiral movement, it goes down into the nasal cavity. So, in maxillary sinus, frontal sinus, and part of ethmoidal sinus, all the secretion, it comes in this part. But in sphenoid sinus and the posterior part of the second half of ethmoid, the secretion comes here, this part. That is known as, it is known by a particular name, and that, so you have three sinuses opening here, and you have the third posterior part of the second half of the third sinus and the sphenoid opening here. That is the normal production and movement of the mucus. Now, coming to the different diseases involving the sinuses. The first in number is infection. So, that is called as, the infection of the sinus is called as the sinusitis. The new name being rhinosinusitis, because the nose and the sinus is, it is considered as one unit now. Always. That's why it's called as rhinosinusitis. So, sinusitis, if the duration of the complaint of the patient is less than 3 months, it is acute sinusitis, and if the duration of the complaint of the patient is more than 3 months, it is chronic sinusitis. Previously, we used to have a terminology called subacute sinusitis also. But now the new terminology is, we just use acute and the word acute and chronic. And the new books, which the new publications, all they have removed the term subacute rhinosinusitis. Now, this infection of the sinus, it can be because of bacteria or virus, or it can be fungal also. The second important disease or pathology involving the sinus is allergy, and the third being granulomatous condition. An example of a granulomatous condition is tuberculosis. So, like that, you have so many other granulomatous condition which can involve the sinus. The last being malignancy. Malignancy, if you consider the whole body statistics of malignancy, only 0.2% of malignancy affects the sinus, and that too commonly it is seen in maxillary sinus, which is seen inside this maxillary bone. Now, let us go through the X-ray. So, if you take a plain X-ray, it gives us a fair idea of the sinuses. So, now in the X-ray, you will be able to see all the sinus: frontal sinus, ethmoid sinus, maxillary sinus, and sphenoid sinus if the mouth is kept open. This X-ray and the four sinuses, viewing the four sinuses, depends upon the age at which we are exposing the patient for the X-ray. Suppose the patient is more than 18 years of age, sure, we will be able to see all the sinuses. And one point I would like to highlight, that when you see an X-ray, if the sinuses, it is black in color inside, that means the sinuses are normal. So, you just see this X-ray, this is a maxillary sinus, pair of maxillary sinus, is black inside. Here also frontal sinus is black inside, ethmoid sinus is black inside. Likewise, when you do a CT scan, this is maxillary sinus, inside it is black in color, so that means its sinuses are normal. And this is the ethmoid sinus, black in color, so that means ethmoid sinuses are ethmoid sinuses, or otherwise it is termed as ethmoidal hair cells also. Now, frontal sinus also inside is black in color, but bear in mind that one exposure of CT scan is equivalent to 185 times exposure to a plain X-ray. Please keep that in mind. So, in this video, we have seen the basic things about all the sinuses, starting from the embryology and the common diseases which affect all the sinuses, and how it looks like in an X-ray and how it looks like in a CT scan. Thank you so much.